Tired of the conflicting advice in the world of health and wellness? Ready for clear, science-backed strategies to live a longer, healthier life? Welcome to the Duration Wellness Show. We focus on health and wellness education to help you become a better, more informed you. Wherever you are on your journey, we're here with you for the duration.
Well, welcome to the Duration Wellness Show. We're back for another fun episode. I'm Dr. Anna Marie, and with me is my mom, Dr. McCarthy, with decades of experience, and back for another episode. And this series, we're actually going to be talking all about gut health, which I am really excited because it's just such an important topic. And I think so many people don't know how important it is and everything that it can affect. So as always, this show is not medical advice. This is for educational purposes only, but welcome, Dr. McCarthy. So excited you're back again. So I don't know if you want to do a little...
This is a great topic.
So I don't know if you want to do a little intro again. I know some of our listeners might have heard you on our other show or other episodes, but in case they haven't, if you want to do a little intro.
Well, I'm a board-certified internal medicine physician. I was working as an internist, for over 40 plus years now, and in private practice. And now I continue, after retiring from my paying job, I continue to run a medical clinic dealing with addiction and homelessness each week, which has also, I really enjoy. It's very rewarding and trying to help them, that so many on the streets that are dealing with so many medical issues and psych issues. But yep.
Yeah, well, welcome. Yep, so lots of experience and still practicing, which is awesome. So I think let's get into today's episode. We're really talking all about gut health. So that's going to be our next series. So I think maybe just to start out, let's maybe go over, it's a broad question, but what does gut health actually refer to?
Okay, so basically by definition, gut health refers to how well your digestive tract is working, especially whether you're having normal digestion and absorption and bowel function without ongoing symptoms like bloating, pain, the irritable bowel symptoms, constipation, diarrhea. So it includes a very important factor is the balance of microbes in your gut microbiome. So microbiome is basically the live bacteria that are functioning in your intestinal tract, and they have such an important function. And if the balance of good and bad bacteria is off, it can wreak havoc on your health, not just gut health, as we're going to be finding out. These good gut microbiome help to digest your foods and support the gut health. And in a healthy, normal gut, the cells that line your gastrointestinal tract maintain this tight junction that keeps the food and the protein fragments on the correct side inside your gut. But molecules resulting from digestion, like amino acids from proteins, are broken down, and then they are transported into these gut lining cells, and from there they go into the bloodstream, which then carries all these nutrients to your body. But the GI tract can become leaky, which we'll go into at length here in this podcast, from something called gut dysbiosis, where the bad bacteria, dys means bad, and biosis, the bad bacteria overtake the good bacteria.
Yeah, and I feel like it's interesting, the leaky gut, it's actually been around, people talking about it for decades, but it's really just in the last, I would say 10 years or so that it's been recognized, more in our modern medicine, like GI professionals are recognizing it, and now we know it is a real issue.
Absolutely. And we're seeing it more even with, as we'll go into here, with changes in our intake of foods, like gluten that has been modified is a real inflammatory agent that can accelerate this leaky gut. And then as we go on later with toxins like microplastics and all the pesticides, they really can destroy the integrity of this lining of the gut, and then we are in big trouble. So, but you can see chemicals also, even from what we're taking in, all of these soft drinks, alcohol, sugar, processed foods, processed seed oils are a big culprit, preservatives, inflammation, chronic stress, medications even like antibiotics. And we're going to go into this again in this podcast or the next one. And now I was reading even aspirin and acetaminophen can have some disruptive function on the gut. But a leaky gut, when it does occur, allows these fragments of bacteria and large protein fragments, not when they're broken down to little amino acids, but large protein fragments and partially digested food to leak out of your gut into your bloodstream. And these fragments then are recognized by our immune system as foreign invaders and triggers this inflammatory cascade. So we know that the GI tract, and once it is in this inflammatory state, that causes so many diseases. So it's important to keep these large protein fragments, from leaking out of the gut and into the bloodstream. And again, it revs up your immune system because it does see it as invaders. And then we're seeing that this could be causing autoimmune conditions. Those are diseases like lupus, where your body doesn't recognize part of itself like it should normally.
Yeah, basically your body is attacking itself. And there's so many different autoimmune conditions, but the body's attacking itself. Yeah.
And so we'll see it in rheumatoid arthritis, lupus, even multiple sclerosis we're seeing from this chronic inflammation. And of course, as we went in our last podcast about Alzheimer's and dementia, that we know it causes also chronic inflammation in the brain cells, and that contributes to Alzheimer's because that gut-brain connection is really important. So, but bacterial products like the gram-negative endotoxins, gram-negative just means it's a type of bacteria, gram-negative bacteria that produce these toxic chemicals called endotoxins, and they can even influence our mood, cognitive function. And there's research that if we can modify that microbial ecology, it can have beneficial therapeutic effects. So again, gut dysbiosis also alters, from our last podcast, your blood-brain barrier. So not only do you have a protective barrier in the lining of your gut, you also have a protective barrier to protect the brain. It's called the blood-brain barrier. And we know that this gut dysbiosis can create neuroinflammatory pathways linked to Alzheimer's, Parkinson's disease, multiple sclerosis. So there's a lot of emerging research being done on the benefits of a healthy gut, releasing beneficial short-chain fatty acids, which we'll go into, and that these are then transmitted via this vagus nerve from your gut to your brain. And these fatty acids include butyrate, propionate, and acetate. So
very interesting.
Yeah.
So let's, I guess, go into a little bit about like short-chain fatty acids. How do those affect the gut?
Okay, so these short-chain fatty acids, when we eat fiber, the colon bacteria ferment it into these beneficial, healthy bacteria in your colon, will ferment it into these beneficial short-chain fatty acids, which are some of them are the butyrate, propionate, and acetate. These bind to receptors in other organs of our body like muscle and liver and fat tissue, affecting the secretion of these gut hormones and peptides that are related, we're finding out, to our appetite and inflammation, energy expenditure, and fat oxidation. And podcast 2 of this, I can go into more detail, but butyrate is such a beneficial small-chain fatty acid that supports not only the integrity of your gut lining and fighting cancer, promoting inflammation and really bad bacteria, and it also protects against obesity and diabetes and acts as like a prebiotic, and it's what feeds your colon cells. Butyrate is a small-chain fatty acid that actually gives nutrients to your colon cells. So, but it's the primary energy source for colonocytes. And so we know that it helps reduce inflammation, strengthens your gut barrier, and support your immune system. And so it's a very important short-chain fatty acid. And I have more on, hopefully if we have time, on podcast 2. But in summary, then that gut health a healthy gut means your digestive tract is functioning normally with your normal gut microbiome in a balanced state, which is really rare to find in most individuals eating the Western diet. So, and then we have probiotics. Those are,
Yeah, so that's what I was going to ask you because
yeah,
I feel like everybody talks about, they know of probiotics a little bit, but I think a lot of people don't know actually fully what they are. I think, and
Yes.
also prebiotics, people are talking about those more. I think
Yes.
that would all be kind of good to get into.
Okay. Yeah, let's do that because I did break them out
Yeah, so
and
I
give
think
you.
maybe first is just what are probiotics?
Okay, so probiotics are live microorganisms, usually bacteria or yeast, that can provide health benefits when taken in adequate amounts. So we really see high concentrations of them in fermented foods and high good fiber foods. And, they really help to support digestion and reduce GI inflammation and symptoms. So that's basically what we see with probiotics, and there's so many different ones on the market. And I mentioned last time that the best way to do it is through your diet to get healthy probiotics. But if you need a probiotic supplement, then I recommend the Bacillus spore probiotic only because that Bacillus spore probiotic doesn't get broken down by the acid in the stomach. And a lot of these probiotics, they really have low absorption and assimilation. So that one is at least protected with the covering, the spore covering, and then it quickly will help these other bacteria to thrive.
Yeah. And then let's
So,
talk about, we'll talk about, I think, some of the foods too, because I think that's very
yes,
important for people to get from
yes,
probiotics. But
that's the
then
best way.
also, I think people get probiotics and prebiotics kind of mixed up. So what would you say
Okay.
prebiotics?
Okay, so probiotics, that's basically what probiotics are. Prebiotics are foods, usually non-digestible fibers that feed beneficial gut bacteria, gut microbes. So common examples will be inulin, that's in benefiber and some of these other fiber sources, and then also fructooligosaccharides. So those are foods that, again, are high fiber content that feed the beneficial bacteria. So I look at it like a fertilizer to allow the good bacteria from probiotic intake to really populate and overtake the bad guys. So prebiotics are really important, we're finding out, and we'll go into some other health benefits too, on that.
And then I
So
think some people also talk about postbiotics.
yeah, that's a new one that they are using, and then a lot of research too, but postbiotics, just for a definition, are the beneficial compounds made when gut microbes break down prebiotics or otherwise metabolize food. So these are just beneficial compounds, and these do include postbiotics, include those short chain fatty acids that I was discussing earlier, like butyrate, and it also includes enzymes and other bioactive substances that can help support the gut barrier and reduce inflammation. So a good way to look at it, a simple way for the layman to see this, is to think about probiotics as the live workers, prebiotics are their food, and postbiotics are some of the useful products that they make. And that's why diets rich in fiber and fermented foods are often linked with better gut support.
Yeah, I like that analogy.
Yeah.
So, I mean, they're definitely all related, right? So
Uh-huh.
you need the workers, so like the
Uh-huh.
actual live, and so, but then you also need the base.
Food,
The
yeah.
food for them to eat, like, or the supplies for them to use, right?
Yep.
So that then they can like make these beneficial products.
Yep.
So I think that's a great analogy.
Mhm.
So I guess something that would be important is like, where would you say the best foods are to get these? I think let's start with probiotics. Like, what would be the best food sources for
Sure,
those?
sure. Well, probiotics, again, are those live beneficial microbes, and the best sources are yogurt with live cultures, which I'm going to go into in podcast 2 with Dr. Davis yogurt, which is really good for SIBO. We'll get into that later. So best food sources, though, are yogurt, kefir, sauerkraut, kimchi, miso, tempeh, kombucha, and then some cheeses and fermented pickles.
Okay.
So those are our, I guess
Mostly fermented food is what it sounds like.
yes, and yeah.
And then what about prebiotics?
So prebiotics would be your fibers that feed your good gut bacteria, and those sources are onions and garlic, leeks, asparagus, Jerusalem artichokes, chicory root, oats, barley, bananas, apples, beans, lentils, peas, flaxseed, and some whole grains.
So that's a lot.
Yeah.
And then I guess postbiotics, you really wouldn't get it from anywhere other than by eating those first two, because then they would produce the postbiotics.
Yes,
Okay.
correct. Well,
So-
they do have some research though on some beneficial compounds. Of course they're made by, like you said, the beneficial microbes in your gut. But they are not usually foods in the same way that these probiotics and prebiotics are, because they are mostly made in your gut when you have a healthy gut flora that ferments prebiotic fibers. So I had a list too of some examples, food examples that you could try, but
Yeah, that'd be great.
well, say if you want to start this, you could start with your probiotics by eating yogurt at breakfast, kefir in a smoothie, or kimchi or sauerkraut as a side, and then some miso in soup. For your prebiotics, you could eat oats with banana and flaxseed, onions and garlic in your cooking, and I would say get fresh, not the stuff that's canned in the garlic. And then beans or lentils in your salads and soups, and asparagus as leeks as your vegetables. And then you'll then, as a result of all of that eating, get some good, healthy postbiotics.
Yeah, I love it.
Is that a little bit of a helper there for you?
Yeah.
Okay.
I mean, I think it's, mostly remembering those probiotics, with like the yogurt and the kefir and the kimchi, all of those sort of foods that are fermented, and then,
Mhm.
high fiber, which I do think people underestimate how important fiber is. And I do
Yes,
think, especially in
yes.
our diet, it really, I think protein is like such a hot topic now, but I think people are forgetting how important fiber is.
Yes.
And it really has such a huge impact on health. And I do think that protein is important too, but my concern is that so many people are now forgetting about fiber, right? And they're only focusing
Yes.
on protein. And I really think overall, if you look at our diets, most people are actually probably getting enough protein, but they're probably not getting enough fiber, which is so important for all of this.
Yeah.
So let's see. So we were talking, I think, before about some of the small chain fatty acids. So let's maybe get into that for gut health.
Okay. So let's see. We would see on the small chain fatty acids. Let's see. Did I finish up on this one? With your, I guess we could also see that these small chain fatty acids, again, remember the main one that I'm going to be talking more about is butyrate. But let's just have an overview of their importance. Are that these small chain fatty acids are microbial metabolites. That's a good way to look at it. They're a breakdown food, So small chain fatty acids are emerging now. It's so amazing how much we're reading about small chain fatty acids, especially butyrate, as these key mediators in our diet and our health. So some of the evidence I can list here that these small chain fatty acids are linked to reduced inflammation and improved insulin sensitivity. Gut-derived metabolites, these small chain fatty acids may influence the gut-brain axis with implications for not only acuity, mental acuity, but also your moods. So that's significant. And we're seeing this in psychiatry even. So, and then we know that dysregulated metabolites that don't have high concentrations of these good small chain fatty acids, they are associated often with inflammatory bowel disease and obesity, and again, neuropsychiatric conditions. So fiber fermentation is like you said, so important to produce these small chain fatty acids like butyrate and improve and heal a leaky gut. So the gut barrier integrity and immune regulation is normalized. And of course, they do also, we know, reduce inflammation and improve insulin sensitivity because, prediabetes, diabetes is all triggered from insulin resistance, and these small chain fatty acids improve that.
Yeah.
So,
And just to review so people understand, and correct me if I'm wrong, this is basically produced by the fiber fermentation. So again, by these
Yes.
probiotics, like when you're taking in probiotics naturally with the fermented food.
Yes.
So it's one of the ways these probiotics also work. So it's really interesting the many pathways, I think, that we're finding that this has a huge effect.
Yeah, and like I said, it's also the main food supply. These small chain fatty acids are the main food supply for your colon cells.
Yeah.
And so if they start starving, they can cause a lot of trouble, even we're seeing with cancer triggers. So,
Well, I
you
mean, and
know,
colon cancer is on the rise, and it would be hard to think that some of it is not related to our diet,
yeah,
right? So
yeah,
it would make sense.
yeah,
Obviously, that's always hard to prove, the causation versus correlation. But I mean, just going through that pathway, it does make sense.
yeah.
Okay, so can you kind of go over a little bit about the gut-brain axis? I think that's something that really has emerged in the last decade of how it's kind of wild, this whole connection between what goes on in your gut and what goes on in your brain.
I know. And again, this started with way back when with in the pediatric arena with children with ADD and some of these psychiatric difficulties. And this Campbell McBride started realizing that the importance of what's in the gut can affect the brain. And so we know that this brain and intestines, they're closely connected by the vagus nerve, and that's part of your brain gut axis. And so there's so much communication that we don't realize how much communication is done by nerve pathways, obviously, and hormonal pathways and immune pathways. And now they're showing so much interaction with intestinal bacteria, which they actually on their own have signaling molecules, the intestinal bacteria that are finding out regulate brain and behavior. And it can be a trigger for ADD, insomnia, anxiety, depression, bipolar affective disorder, and other psych issues. So, and that's why at the clinic I run downtown, I have them all on a probiotic prebiotic. At least it's a little bit of help. I know the diet isn't so great, but we know that gut dysbiosis or bad bacterial overgrowth in the intestinal tract causes that leaky gut, thereby letting these toxins get into the bloodstream that we discussed earlier. And that this also causes that blood-brain barrier that protects your brain tissue also becomes compromised from leaky gut because of all those inflammatory chemicals that are coming through. And then instead of having that protective blood-brain barrier with its integrity, you get a leaky blood-brain barrier. And that has been implicated in increasing amyloid, beta, and tau proteins. And those are the main proteins that are laid down for developing Alzheimer's.
Yeah.
So that's not a good thing.
Yeah, which I mean, we talked about a little bit, on our whole dementia
Yes,
prevention
yes.
podcast and everything about how that's so important. So it really has a huge effect.
Yeah. The other one I've been reading about, and I'm sure you've heard this too, the periodontal disease caused by a bacteria in the mouth called Porphyromonas gingivalis. I just remember it as P. gingivalis.
Yeah.
Which increases inflammation in the brain also and triggers dementia. So just a healthy gut flora, even in the mouth, through the intestines to the end, that's part of your gut flora, is important for brain health. And we know it's also important for our dental health and our oral health. And
I honestly think so many people underestimate how important the oral health is, because we already know that it increases risk, even your cardiovascular risk,
Yep.
just overall inflammation, right? And
Yes.
inflammation then begets inflammation. And I think that a lot of people forget how important that, you actually have a whole microbiome that's in your mouth, that's, in your teeth. And there's a lot of stuff, in terms that we eat and drink that gets that all out of whack, right? And that's kind of where it starts. And
Yes.
so I think, it's not surprising that it also would have an effect on the brain. So
Yeah, and if time permits, in podcast 2, we're going to go over some of the benefits then of having a healthy oral microbiome population, and when you don't have it, it's amazing what it can cause. But like you said, a lot of it is just this horrible inflammatory state in multiple areas of your body. So we do know, though, that as time goes on, we're finding out more and more. I do suggest, even for the mouth, like, and we'll go into it in the next podcast, but like when people gargle with Listerine, that kills a lot of the good bacteria and has been causing some problems. So I do suggest doing a coconut pull where you swish the coconut oil around between the teeth. It gets them white and does a good job in restoring the normal oral flora. And then you can even get probiotic toothpaste. Now, I don't know if that will do the trick, but just trying to go more natural. And now I just ordered an electric toothbrush that does not have plastic bristles. Plastic bristles or nylon bristles. That's a Petro company byproduct. And so we were able to find one that's made from bristles that are made from castor oil bean.
Nice.
All natural, and then the handle's bamboo.
Yeah,
so.
they're starting to make more, which is really exciting. And yeah, I do think people don't realize, a lot of those mouthwashes like Listerine, how they can really mess up that, your mouth health, and then how it has an effect. I would have to double check on this, but I think Listerine is actually one where there's like a lawsuit that's out for them because there's like a concern about it maybe increasing the colon cancer risk.
Yes, and esophageal. Yes, I think you're correct.
I mean, it's just kind of, I think, something that probably a lot of people don't realize how, but that kind of shows how that can affect, the rest of your gut and everything. So how else would you say gut dysbiosis affects our health?
Well, this on its own could be like 100 podcasts, but I'm just going to mention a few. And I think this should be a branch of medicine, not just GI, but another branch of medicine, a specialty on gut health.
Yeah.
I mean, that's how important it is. But one of them I was just recently reading about is a fatty liver causing leaky gut connection. So leaky gut causing the fatty liver. So small intestinal bacterial overgrowth has been associated with fatty liver disorders. And we know, and we're going to go into what SIBO is.
Yeah. And so just so you don't, for those of you who don't know, so small intestinal bacterial overgrowth is also called SIBO. So that's, if you hear that, it's the same thing. And
it's basically the bad bacteria, not just being in your colon, it's specifically the bad bacteria in your small intestines, which we have a lot of people in this country eating the Western diet have some degree of SIBO. But anyway, the metabolic dysbiosis and leaky gut, they have increased these circulating bacterial toxins, and one of them is called LPS. So those are endotoxins from these bad bacteria growing in the GI tract. And they also have elevated the intestinal permeability, leaky gut, as measured, and they usually measure that by a chemical called zonulin, ZONULIN. So all that to say, when you have this bad bacteria growing in the intestinal tract, it's been associated with this compromised intestinal permeability, which leads to fatty liver. So that's one of them. Just to put a few of them in here, ADHD, we went over some of these psychiatric generalized anxiety disorder, depression, autism, learning disabilities, obesity, diabetes 2, pre-diabetes, metabolic syndrome, Parkinson's disease. These are just a few of the conditions found to be very much influenced by your gut microbiome. And I'm going to go into some of these toxins, but we know that even that herbicide glyphosate in Roundup triggers this zonulin, which measures how much of a leaky gut you have. And gluten does the same thing. So we're going to go into depth about that too. But those two are the most powerful triggers of this zonulin release. It's that modified gluten, which occurred in the 60s. And the other thing, if you look at a chart, obesity rates continually started to take a climb from the 1960s to the current time. We didn't used to have this much obesity and diabetes, But what was introduced in the 60s? We had microplastics, which we'll go into, and this modified grains, all causing inflammatory state, gut dysbiosis, and real big problems on our metabolic health with diabetes and so forth. So that's just touching the surface there. And we know that as the process worsens with this gut dysbiosis, you get more production of pro-inflammatory cytokines, interferon gamma, even something called tumor necrosis factor. These cytokines, then you started this vicious cycle. They actually further worsen the permeability. So it's chronic inflammatory disease. And with that dysregulation and that pathway occurring, that has been implicated in causing, again, these autoimmune diseases such as celiac disease, type 1 diabetes, inflammatory bowel disease, multiple sclerosis, ankylosing spondylitis.
Well, because I think a lot of people, don't realize. So you have your genes, right? So your kind of genetic profile, but that usually then those genes have to be triggered, right? So then there's a trigger to turn them on. And so people who are predisposed to this, then they get all of this inflammation that then continues a cycle of inflammation that then can turn on those genes.
Yes, so, it's what they call that epigenetic effect, where these bad bacteria can change and modify the genes, the function of your genes, and to function in a negative way. Some other ones, again, that insulin resistance, fatty liver, gestational diabetes, high lipids, type 2 diabetes, and irritable bowel, non-celiac gluten sensitivity, environmental enteric dysfunction. So you have so many nerve cells in your intestinal tract, and that's your enteric nervous system. And we're finding out more and more that they're so important and it can definitely cause diseases in the proximal intestinal tract. And then we see, as I mentioned, schizophrenia, autism, and also brain and liver cancers.
I didn't know about the brain cancers, but, going over what we had just talked about in terms of the gut-brain axis and then the leaky brain barrier, from the leaky gut. Yeah. That makes sense, right? Because then you're going to get more toxins that are going through to the brain, and all of that will cause inflammation, which then, it
makes sense.
Yeah.
But it's, again, you're saying it's correct. We're seeing so many cases of colon cancer. In fact, there are more colon cancers now in people younger than 65 years old than there are
lowering the
in my
screening
age.
Yeah, they keep lowering the screening age because of that.
So something's doing it. And then the other one I was going to briefly mention is this gut bacteria causing eating disorders.
Which is, interesting because that is, I know, a huge issue, especially for the teenage group, middle school, college, I think, eating disorders, and then it can continue as they're adults too.
Yes, yes.
I definitely want to get into that because I could see how that could then cause a cycle that gets worse, right? So you start having an eating disorder and then that gets your gut biome off, and then that could trigger
yes,
that it's like a cycle, because then your
another
gut biome
vicious cycle
is off, and then you're more predisposed to getting the anxiety and getting
I thought this was fascinating when I first read it, because it could be a potential treatment to help with those that are binge eaters or struggling with anorexia, or because they are labeled under psychiatric illness, and they usually give them psychiatric meds. But if they could just try doing this, at least to add it to their protocol,
it might help
better.
Even maybe decrease some of the medicines that they require or something. At least, I think anything that can help for that treatment, because it can be so hard to treat.
Yes.
Anything that can help is good.
Yeah.
So.
In my day, they had a famous singer, this is just a little aside, but Karen Carpenter, she had a beautiful voice, and she actually died from anorexia nervosa.
It's really difficult to treat. Severe cases of anorexia are very difficult to treat, and it's really sad. So I think that anything that can help is good. So
so this study showed that definitely gut dysbiosis can trigger that binge eating and weight gain also. And there were similarities in microbiome patterns between humans and mice with compulsive eating disorders. including this increased proteobacteria and a decreased actinobacteria and blottii. Now, you don't have to remember the names, but it's just saying basically these good bacteria were lowered and the bad bacteria were higher in these binge-eating patients. And then the gut-brain axis plays a crucial role in food addiction and binge-eating disorders. And gut microbiota can produce substances affecting your appetite and mood, potentially influencing eating behaviors through the vagus nerve. So I thought that was interesting too, because we can see, we'll get into it, the GLP-1 agonists and how they work, and then research has identified distinct neural pathways for fat and sugar cravings that originate in the gut. So I'm a chocoholic. When activated simultaneously, these pathways lead to this increased dopamine release. That's the chemical that's the pleasure chemical in the brain. And then that drives overeating. So if that's off, then then your appetite's going to be off. And then Akkermansia mucinophilia, that's a very popular bacteria we're reading a lot about, but it is a beneficial gut bacteria. And here's where it goes with the GLP-1 medicines. Akkermansia is associated with improved metabolic health and weight management. It enhances gut barrier function, reduces inflammation, and may help regulate your appetite through the effects similar to these GLP-1 agonist meds like Ozempic and all
like
the others.
Ozempic, Wegovy, those sort of ones.
Yeah. And mucinophilia, remember, means mucin, and then philia always means in the Greek loving. So it's mucin loving. And if this Akkermansia, this beneficial gut bacterium, is not fed with our healthy fibers that we were talking about, and inulin and so forth, and polyphenol-rich foods, then eventually it will feed itself on your mucus lining. So you want to make sure you got the whole thing corrected and proper nutrition for this bacteria, so then it can have the beneficial effects of reducing inflammation and potentially reducing weight gain and all of these other appetite regulation. So, and the last, I think there's a few more on these. If you don't mind, I would like to mention this new kid on the block that I've read about, Turicibacter, T-U-R-I-C-I Bacter, Turicibacter. And this was a study that was recently published in Cell Metabolism, where these investigators narrowed a long list of potentially anti-obesity microbes.
Interesting.
And that would be very popular to get if
Yeah.
And the one that came out as the top one that was beneficial was Turicibacter. So in mice fed a high-fat diet, supplementation with this bacteria led to less weight gain, lower blood sugar, and lower levels of fat in the blood compared with controls. And the team focused particularly on these ceramides. Now, what are ceramides? C-E-R-A-M-I-D-E-S. These are bioactive lipids that rise with high-fat diets, and they are increasingly implicated in causing metabolic dysfunction. So, high-fat diet can release these ceramides. Well, these elevated ceramides will increase intestinal fat absorption, promote fat storage, raise your sugar, raise your insulin resistance. And they've also been linked, obviously, to type 2 diabetes and cardiovascular disease. And so some studies suggest that ceramide levels can actually, as a better risk, a potentially risk factor to measure than LDL cholesterol. But anyway, here's where it comes in. This bacteria, the Turicibacter, it produces its own lipids, and these are good lipids that it produces. So it's interesting. This bacteria produces its own lipid molecules in the gut, but rather than worsening metabolic health, these lipids that this bacteria produces appears to suppress that ceramide production, the bad guy ceramide. And so the ceramide surge is what what I just went over, how negative it is on your health. That is what is released when you have a very high-fat diet. and it has negative implications. Well, here, taking this Teresa back to negates that effect because it produces its own lipid and lowers the ceramide. So that's why they're seeing really good results in this bacteria interrupting that vicious metabolic feedback loop that you were talking about and pushes the patient's, that vicious metabolic loop is what's leading to the obesity and sugar abnormalities. But if you take this little bacteria, it has shown to really help with obesity and causing benefits for your metabolic health. So I think it's a new kid on the block, and whether how much they can formulate this, I think the best way is going to be getting foods. And I didn't have time to look up foods that are high in this particular bacteria, but I would bet it's a bacteria that's a high content in a Mediterranean diet.
Yeah.
Which,
it would make sense since the Mediterranean diet is so helpful for your cardiac health and just overall health.
Overall gut health,
But,
too, we'll find out.
But it is interesting. I mean, especially the cardiovascular effects too, So
Yeah, because we keep hearing things about Archimania, and that's so beneficial. And yes, it can be if it's properly nourished with
Right.
the fiber, but it's also hard to actually get that in you because it's an obligate anaerobe. That means it cannot have any oxygen exposure.
Right.
And so again, it's hard to get that concentration. Later on, I'll go into some researchers are using not using the live Archimansia, but using some of the protein fragments of Archimansia with some benefit. But this one is, I think we're going to find out a lot more about it from that study.
Yeah, I think that's so interesting.
Yeah.
I guess let's get into a little bit about, just the gut permeability and autoimmune issues. So we kind of talked about that before, right? So like people have genes that can kind of predispose them to certain autoimmune issues, meaning the body's attacking itself. But how does the gut play a role in that? And, just like this gut dysbiosis, meaning that the gut microbiome is out of whack.
Yes. And that it's important to realize, after we went through COVID and the exposure to the spike protein and all the health issues with COVID, we do know it interrupted the integrity of the gut lining. And so we saw so much inflammation. And because it interrupted the integrity of the gut lining and caused leaky gut, we also saw a rise in these autoimmune diseases.
And you wonder if that also had an effect of like what people call long COVID too,
Yeah. Yes, I think it has been a problem with long COVID. But as far as we do know that it compromised your gut integrity, and then we saw this surge in autoimmune diseases afterwards. So we know that dysbiosis and gut permeability and autoimmune diseases are related. And there's a part of our intestinal tract called the ileum. And
just for people to know, so you have your intestines, right? So you have your small intestines, which most people have heard of, and then you have your large intestine, also colon. But your small intestine actually has three parts to it. So it's a duodenum, jejunum, and ileum.
Yeah.
And so this is that one of those three parts of the small intestine.
Yeah, very good. Thank you. Yeah, the ileum is the most active section of our GI tract now, we're finding out. And the bacteria there contain 100-fold more genes. This is what we discussed earlier. Than humans have 20,000 genes. Well, the bacteria in this particular part of our GI tract, the ileum, have more genes than we have. And infections or dietary changes can alter the bacteria in that part of the gut. And then these epithelial cells secrete these, what they're finding out are glycosylated or sugar-coated proteins that form mucus layer that serves as a barrier to other bacteria, right? And that's what helps with the tight junctions and preventing bad bacteria from passing through, and protein fragments, all the other things we discussed. So microbes are necessary for digestion and metabolism and our immune system. But when we get an improper balance, it can cause food intolerance, allergies, and these autoimmune diseases. And with inflammation and bad bacteria overgrowth, these epithelial cells produce, again, that protein zonulin that measures your leakage across it. And this zonulin is then secreted into the lumen, and it messes up the regulation through receptor sites. It messes up that tight junction. So, and it starts to break down. Now, I was just studying this too. They have this new investigational peptide called lorasotide, and it actually has been in the studies, antagonizes this zonulin, this bad chemical that measures your protein, your leakage, your leaky gut. So this lorasotide it's just an investigational peptide at this point, but it blocks the effects of inflammation that break down your gut lining. So, but I guess the best way to do it is have a healthy diet. But I'm just saying that is being used for celiac and some of these other diseases, autoimmune diseases. But we do know patients with autoimmunity have autoantibodies, right? And as you said,
basically their body is attacking itself.
Yes. It doesn't recognize itself as a normal part of its tissue and attacks it. And that leads again to things like rheumatoid arthritis, lupus. And they actually are found to have higher zonulin levels. So that's showing that they have a higher amount of leaky gut and then fewer tight junctions. And so, we see these other markers they have out here for leaky gut, but that zonulin is a big one. So is LPS, a lipopolysaccharide, a toxin released from bad bacteria. But this new drug, it'd be interesting to see if it pans out. But I thought that was interesting. They're working on developing these medicines that will counter these problems. But again, you don't want to just get a pharmaceutical to counter that. You want to find out the root cause and correct the root cause.
Right. And honestly, it's not exciting, but most of the time it is something very boring, like eat more fiber, eat a healthy diet. It kind of
eat
back
real
to the
food,
basics.
not processed food.
So it's that
a lot
really
of times
ends
people
up being a lot of times people say they want to have the root cause, but in reality are still having sodas or junk food.
Yeah,
or,
and the
eating
ultra
out a bunch
processed.
and it's like, well, at the end of the day, really, it is this very boring, very basic, eat healthy, limit the processed foods, up the fiber, add in these prebiotic foods, these probiotic foods, it's kind of the boring basics, but they're very important.
And if you get the good bacteria repopulated at good concentration, then you see all these factors will be corrected, these unhealthy consequences of an unhealthy gut. And you don't need even GLP-1 agonists. Your body will naturally produce it, as we just read, with Archimansia and good healthy microbiome there. So I agree. I think we're in a time where people don't want to give up that ultra processed foods and foods that they really enjoy.
And I don't want to downplay the addictiveness of it either, right? I mean, we kind of talked about that response to dopamine, right?
Yeah.
So that dopamine response is like it's the addiction response, right? It's that pleasure reward, So it's the same as like when people are gambling, when people are going and for shopping addicts, right? You're getting that dopamine response for
drug
smokers,
addicts,
for drug addicts, and food now, the way it's been engineered is to bypass the body's like checks and balances. It is to stimulate more of that dopamine because then they know we're going to buy more, right? So this ultra processed food, it is so dangerous because it makes it so difficult for people to actually, have that healthy response. And so I don't want to downplay the addictiveness of this ultra processed food.
Oh, yeah.
Right?
For me, with chocolate and sugar, and that's really something we should get rid of in our diet for sure. But I
where I think,
can totally relate to people that have that difficulty.
Well, and I also think that's where sometimes these GLP-1s can help, because a lot of times people are in this vicious feedback loop, right? Where they have all these high addictions to food that they don't realize, right? And it's causing this gut dysbiosis, which then is just this vicious cycle. So then sometimes, I mean, we have these tools and they can be healthy. So I don't want to downplay that, but overall, it really is, a lot of this.
But while you're taking it wouldn't hurt to start this change.
Well, no, that's definitely what you need to do, right? Is a combination. It's not just taking a medicine, but then also treating the root cause and changing. So then you have something that's helping you, right?
Yep.
So I think something else that I think is so interesting is, how gut dysbiosis, meaning this gut system getting out of whack, how it can affect Parkinson's. Because I have
Yes.
seen that a lot more, in certain studies
Yes.
and articles, how this can actually relate to Parkinson's. So I thought that would be
Yes.
interesting to go into because that
Yeah,
has been
let's do
increasing.
that. I agree because you are reading so much about that. The link between our gut and our brain, and especially the role it plays in the onset of Parkinson's disease. So we see this was a recent article that added further evidence to this link because what they did was they identified gut bacteria likely to be involved and linking them to having decreased riboflavin, which is vitamin B2, and biotin, vitamin B7. So the gut microbes that were bad were causing decreased production of these B vitamins. And so the authors were hoping this would lead to a discovery that there would be a simple treatment that could at least help, which would be with the Parkinson's disease we're talking about, which would be these B vitamins. And the supplementation theory targeted these particular two B vitamins, riboflavin and biotin, and it holds promise as a potential therapeutic avenue for alleviating at least some of the Parkinson's symptoms and slowing down the disease progression.
Interesting.
So that was done by a researcher, Nishiwaki, in Japan, and that study was published in May of 2024.
Well, and I think
So
that, for anybody who knows somebody with Parkinson's or has Parkinson's, they know, unfortunately, while there is more treatment, there still isn't a cure, right? And it can
yeah.
progress differently. And so if there is anything like this, especially that's, relatively low risk, taking a B vitamin, if there's some help,
Yeah.
that's great.
And we'll go into correcting your gut biome, which produces these B vitamins too. So anyway, the neurodegenerative disease Parkinson's impacts around 10 million people globally. I didn't realize there was that many. And the symptoms begin, usually the first symptom, which surprisingly was constipation, and then sleep problems. And that can occur up to 20 years before someone develops Parkinson's disease. So, and previous research found people with Parkinson's disease also experience changes in their microbiome long before this debilitating muscle control and all these other symptoms occur with
Wow.
Parkinson's. So
That's wild.
that is wild. And while different groups of bacteria were involved in different countries, because they examined the flora from China, Taiwan, Germany, US, a few of these countries, they all influence, interestingly enough, these pathways that synthesize B vitamins in the body, in your gut, these good bacteria that make those B vitamins for the brain health. So the team also found that changes in gut bacteria communities were associated with a decrease in the riboflavin biotin in people with Parkinson's disease. And so it showed that the lack of these B vitamins was then linked to a decrease in our short-chain fatty acids, right? And certain polyamines molecules also that create this healthy mucus lining for our gut integrity. And deficiencies in these small-chain fatty acids would indeed lead to thinning of this mucus layer, our gut lining, and increase the leaky gut. So that was also seen, the thickness of that gut lining and the leakability. I don't know if that's a real word, but they were both observed in almost all the Parkinson's patients had that state.
And now correct me if I'm wrong, but this is what we were talking about earlier in terms of you have the highly fermented foods, the probiotics that end up then making these short chain fatty acids like the butyrate and things like that.
Yeah, well, they're food to allow your good bacteria to populate, which then produce these B vitamins. Okay. And we know it also, they produce the small chain fatty acids.
Right.
So it's really feeding the good bacteria so they can produce the good products, which include small chain fatty acids and these B vitamins.
Yeah.
So, and they suspect that the weakened protective layer exposes this intestinal nervous system called the enteric nervous system in our intestinal system it actually leaves them exposed to more of the toxins that we now encounter in our daily life, which includes, the GMO and non-GMO, even wheat products, glycophosphate, microplastics, and we're going to go into a whole thing. But one of the ones I want to mention today is we already know there's confirmation, pesticides and herbicides, cleaning chemicals, they have all been implicated in triggering Parkinson's disease. So the last podcast, we mentioned that on golf courses, right?
Yeah. Which is like, we're in Florida, and so golf courses are all over. And I think it used to be, and it still is, very popular for people to live next to a golf course. That used to be like the prime spot to live. And I think, we'll go into this a little bit, but it's kind of
scary.
Yeah. Now that
they start cleaning it up.
Yeah, because even if you're not right next door to, a golf course, there's so many around here, right? So all of the spraying that they do is still going to drift into the air and everything. So, but anyway, so I guess, let's talk a little bit about, the golf courses and the possible Parkinson's link that's been around.
Yeah,
that's been talked
this
about
is really, you could just see the increase from all the toxins that we're living with now. But pesticides sprayed on these golf courses are found to be aerosolized too, and they can frequently drift in the air. And so they found out the closer you live to a golf course, especially within a mile, the greater your likelihood of developing Parkinson's disease. Specifically, your odds nearly double, a whopping 126%. When you reside less than a mile from these chemically maintained spaces. So, and even they suggested try to find out if you're living on a golf course and you can't move, that you should try to know when they're spraying and close your windows. You need to know which way the wind is blowing so you can limit your exposure of the aerosolized chemicals. But even modest increases in distance can cause exposure, even up to 3 miles away. But if you move further out, the risk of Parkinson's move further out from these golf courses that are spraying with these pesticides, the risk of Parkinson's dropped more notably at about a 13% drop for every extra mile. So, however, the highest risk zone consistently hovered at the shortest distances, which again highlights the finding that proximity matters the most of whether you're going to develop this Parkinson's from golf courses. But
it makes sense, right? Because you're just at the higher level of exposure.
Yeah. And drinking water near golf courses also heightened the risk. Residents dependent on groundwater within these contaminated zones also experienced nearly a double a risk of developing Parkinson's. So the researchers strongly believe that pesticide residue infiltrates the local water supplies, not just aerosolized, in the water supplies, and then becomes a direct threat to residents who consume this water daily, unaware of this invisible chemical burden they face, especially if they don't have, purifiers like reverse osmosis.
Well, it makes sense, right? Because they're spraying the grass, they're trying to keep the area, without the weeds and have it nice, looking nice so that everything else doesn't pop up. But that is then getting into the ground, which then goes into the water, which then people drink. So I think it makes sense that it goes, air and water. But that's where I think a lot of times people don't talk about how important a good air filter system is.
That's a good point, yeah.
Because a lot of times people just talk about if you have asthma or COPD or like a respiratory issue. But I think, as we're learning about all of these exposures, that's a lot of people might say, well, hey, I live on a golf course, but I can't sell my house right now and move. Well, this is where, at least getting a really good air filter system in your house and your rooms, where you're at least trying to clean that air as much as you can.
Yes,
and a good water filter system, where it's cleaning out these toxins.
And if you have to get a new car with all the forever chemicals in it, keep the windows rolled down, especially on a hot day.
Yeah.
But we go into that on podcasts too.
Yeah, but I just, for those who are like, I live on a golf course, this is horrible. Well, there's, just
things you can do to mitigate the
So that's
negative
where
effect.
I think an air filter and a water filter really can be very, very helpful.
And the other one I wanted to mention is atrazine. This is another herbicide in agriculture, and it quickly spreads through water systems and air. exposing people also, through the drinking water, food consumption, and environmental contact. And this recent research shows that also atrazine exposes and accelerates our brain aging and increases the risk of neurodegenerative diseases like Parkinson's. So there's always something else out there. And such toxins we know from Parkinson's patients, it's been shown that they cause overproduction of the alpha-synuclein synuclein molecules. And these are the molecules that attack the dopamine producing cells in your brain, in a part of your brain called the substantia nigra. So that's how it works for Parkinson's. It causes this production of these horrible alpha-synuclein fibrillary tangles and molecules that then inflame the nervous system and eventually lead to these debilitating motor and dementia symptoms of Parkinson's. So all those pesticides, herbicides, just not good. And it's also possible, we're hoping at least, that taken from that Japanese study, taking some high doses of methylated B vitamins, because that goes through the blood-brain barrier easier, the methylated form of B vitamins, can prevent some of the damage. But it all suggests that the importance of a healthy gut microbiome to protect and reduce the negative effects of these toxic pollutants in our environment. And so we're always finding out what you eat and how healthy our gut is. It has such importance on our aging, sleep quality, our overall health. And so we're finding out more and more that this is just so important for our overall health. And we'll go into it in the other podcast, but research has also found that some bacteria in our guts can absorb and store the forever chemicals, the polyfluoroalkyl substances, and those are called our forever chemicals. So there's so much ongoing research on this topic.
There is, and I do think it's interesting, with the microplastics and the forever chemicals. Now it's coming out that when you have a high fiber diet, it almost coats the intestine, and so that kind of helps decrease the absorption of these microplastics and forever chemicals, which is yet another reason, right, to have a healthy diet and a high fiber diet. So I think it's kind of, again, reconfirming how important this is.
Yeah, and oats, and there were some other grains that were very important for that, what you were just describing. I can't remember the chemical in it, but if I...
Trying to help with the mucin layer, basically, where it helps with that increased fiber,
Yeah, and... so anyway, this is interesting because this came out of Cambridge, that they theorized that boosting the good bacteria could actually help, if you get this particular bacteria, reduce the polyfluoroalkyl substances of forever chemicals, so we could actually excrete it. But again, that's pretty new.
Yeah. Well, I mean, I think that's a lot. I think it's it just is I would say the tip of the iceberg in terms of all the effects that gut health plays.
Yeah.
So we're going to continue more of this, on a few more episodes, all about gut health. So, but thanks so much. This was great. I'm sure everyone learned a lot from this first part in our series, and we will continue soon.
Okay, sounds good.
Thanks.
Bye.
Thank you for joining us for the Duration Wellness Show. We hope you feel equipped to apply today's science-backed insights to your daily life. To find show notes, past episodes, and all the resources we mentioned, visit us at durationwellness.com. As always, this podcast is for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect those of the host. We'll see you next time, and as always, we're here with you for the duration.